Today I'm going to discuss my and the Kellogg Library's engagement with the PLANS program. Has anybody in Nova Scotia, because it's a Nova Scotia thing, heard about the PLANS program? Interesting. So, PLAN stands for Promoting Leadership in Health for African Nova Scotians, and it seeks to increase representation of African Nova Scotians in the health professions through recruitment and retention, community collaborations and partnerships to really improve the health outcomes within the African Nova Scotian community. PLANS offers an assortment of programming, including summer camp, which I'm going to focus on and discuss because that's where I've engaged with it, mentorship, resources such as health program and career information, and attends community and school events to provide health career preparation and support to kids in junior high, high school, and this includes their parents and family, community members, education and health organizations, current post-secondary students, teachers, student support workers, guidance counselors, post-secondary staff and faculty, which is us here today. So I was at an education conference on the DAL campus. I should let you know, PLANS doesn't just operate at DAL. One of their main offices is here at DAL, but they support students throughout the province of Nova Scotia. And that's high school students and secondary students that fall under the umbrella of African Nova Scotians. So I was at an education conference here on campus talking about information literacy and got to know one of the coordinators at PLANS. And she said, "We run summer camp. Could you build a library component for us and come deliver it through summer camp?" So I thought, yeah, that's great, wonderful. But one of the big challenges I realized in saying, yes, this is fabulous, is the general population of students I deal with are med students and pharmacy students, which have a degree before they join that program. So I'm used to dealing with students that are kind of 22 and above. And so figuring out how to do programming, I had all the information literacy skills, but for high school students was a whole new population. So working with students grade 8 through the end of high school. So I focused on the space, people, resources, and services within the library in setting up the training. Our initial pass at this a few years ago was to make the library a welcoming place for them, that as they progressed through their education and went to university, they would see the library as a resource and place they wanted to go. So that was the initial goal. And over time, this has evolved. We wanted the students to have a positive experience in the library. And part of that space thing was the Kellogg used to be one space, so I could set the high school students loose in the space and let them run around and not lose any students. But now we're in two spaces, so I had to get strategic over time as our spaces evolved that we didn't lose high school students because I didn't want that to happen in the library. Next up, the competition. So when you tell a bunch of high school students, we're going to have some library programming, I was up against things like the dentistry, their half day in dentistry, they get to do simulated patient stuff and fill cavities in teeth. How do you beat that with the library? So that came in the resources. So health sciences libraries, we have things like anatomy TV where you can take the bones and skin and muscles and manipulate the faces. So coming up with activities for high school students that wouldn't gross them out, but would engage them, that we're not just, a place full of books. We have online tools, we have study guides, we have people that will help you. So it was lots of fun. Initially, we did kind of a scavenger hunt activity, but over time, the PLANS program evolved. And they have a junior program now, grade 8 through 10, and then a senior program of 11 through 12. So this then, once again, with our space and our resources and our people, everything evolving over time, then the program evolved. So with the younger kids, we've been doing programming around like spotting fake news. We've done interactive sessions where they get into groups and they might learn how to do advanced Google searching, because that's the other part of this group is they're high school students, so they don't have access to the full medical library as students, and they don't necessarily maybe have the research skills in that area. So all sorts of interesting things. We've done all sorts of tools. The younger group definitely have been the bigger challenge in terms of just introducing them to the space, trying to give them some tidbits, and over time between grade 8 and 10, they might go through the summer camp once or twice. So making sure our programming is evolving so they don't say, "We saw you last year, you're still not as cool as dentistry." So you want to engage them. The older group, when PLANS moved into that program with the older group, the grade 11s and 12s have a research project and they work in a pod for a week and they're given a health topic. So we were able to think about how can we make that programming more advanced? And thankfully, Dalhousie School of Information Management offers a practicum program. So myself and the coordinator of plans here at Dal, Michelle, we put in for a practicum student, and we had them work on the African Nova Scotian Health Resource Guide. And this was set up for the camp for the grade 11s and 12s to engage them on things like presentation skills, health programming, and all that. And you might say, why is the project share curriculum up there? As this was all coming together, a colleague of mine was at the Medical Library Association conference in I think it was out west somewhere. And she said, I just saw this great presentation. I think it ties into what you want to do. So this is a Creative Commons licensed curriculum from the University of Maryland, and it aims to build high school students' skills to reduce health disparities at the personal, family, and community level. The curriculum aligns with national standards in the US and can be used in diverse settings nationwide, so schools, libraries, they mentioned the libraries, so that was good. And the curriculum has 6 modules, including health equity, quality health information, taking care of your health, smart food choices, crafting and delivering the message. And there's a variety of learning activities you can develop. So that was our guiding document when we got the Sim Practicum student. She worked at going through and coming up with learning objectives and worked with our community here, both the plans people and their community, as well as the library, to make sure our resources, it couldn't be things behind paywalls, which are power walls, I guess. So that we're kind of building on that. And we had some local consultation, and they gave us some feedback. So things like around healthy eating choices, we picked up on some African Nova Scotian cooking cookbooks and things like that, making sure they were in the local public library, so directing them to resources, because some of the students at summer camp are from Yarmouth, some are from Cape Breton, they're from all over the province. So making sure that we were engaging them throughout. So I just have 2 links for you. There lots of information on plans if you want to know more about the program, because they do support students throughout the province, both at the university level, college level, and high school level. So yeah, thanks.
Thank you, Melissa.
No problem.